9 out of 10 bottles of eye drops people buy at the pharmacy they don't actually need. And some of them are quietly making the eyes worse on top of that. It sounds strange. Drops feel like the most harmless thing you could ever put in your eye. But that's exactly why people get them wrong so often. Let's go through it calmly, step by step. Which drops you're most likely buying for nothing, which ones can harm you with constant use, and the one type that genuinely is worth keeping on hand, though even with that one, there's a catch almost nobody thinks about. Let's be honest about how a person usually picks their eye drops. The eyes go red, they get tired by evening, they itch or feel dry, and there you are, standing at the pharmacy shelf with dozens of nearly identical bottles. Relieves tiredness, removes redness, moisturizes, vitamins for the eyes. You grab something on the pharmacist's advice or from an ad, you put it in, and it seems to help. Problem solved, it feels like. But here's the catch. Eye drops are not cosmetics and not a habit. They are medicine. And every medicine follows one simple rule. It works only when it's matched to a specific cause. So here's the thing, worth understanding once and remembering. Redness, tiredness, dryness, these are not a diagnosis. They're a symptom. The very same redness can be hiding a dozen completely different causes, and each one needs a different approach. When you drop in something for redness, you're not treating the eye, you're just switching off the warning light on the dashboard that was trying to tell you something. The car doesn't get fixed by that, it just stops blinking. Let's start with the most popular category, the drops that take away redness. They work very simply. They narrow the vessels on the surface of the eye and the redness disappears for a while. You put them in and a minute later the eye is white again. But a few hours later the vessels widen back, often more than before. The eye goes red again. You drop more in, then more, and you slip into a vicious circle where, without the drops, the eye looks worse than it did at the start. And the cause of the redness was there the whole time. It was simply hiding under a cosmetic effect. These drops don't treat anything, they mask, and the longer you use them blindly, the harder it becomes for you and later for the doctor to work out what was actually going on with the eye. The second common mistake is antibacterial drops. People put them in for almost any redness or when the eye is leaking a little, often with no prescription at all, simply because it helped last time. But redness and discharge can be viral, can be allergic, can be bacterial. Those are three completely different stories with three different solutions. An antibiotic dropped in at random will, at best, simply do nothing. At worst, it blurs the picture so much that sorting it out afterwards gets harder. It's not a universal something for the eye. It's a precise instrument for a specific situation. The third category is vitamin drops, and everything that promises to improve your vision or stop it from getting worse. This one is simpler than it looks. If you have nearsightedness or farsightedness, no drops will change the shape of your eye or replace glasses, lenses, or correction. Dropping a vitamin into the eye is not at all the same as giving the eye what it actually needs. Most of the time, all that's behind it is reassurance for the person doing it, the pleasant feeling of, at least I'm doing something. Apart from that feeling and the money spent, usually nothing remains. And now for the one type that genuinely is needed sometimes, moisturizing drops, artificial tears. If the eyes really do dry out from screens, air conditioning, contact lenses, the dry air of winter, these drops can truly bring relief. But there are two traps here too. First, not all moisturizing drops are the same. The cheap ones often contain preservatives that, with frequent use, start to irritate the eye themselves over time, and the person drops in more and more, thinking it's helping. The second trap is more serious. Dryness is also a symptom, not a cause. Behind it, there may be, for example, inflammation of the eyelid edges, or a problem with the tiny glands responsible for a normal tear film. And then you can drop tears in every hour, and the root stays untouched. And here we come to the main thing. The problem isn't the drops at all. Good, properly chosen drops are an important and necessary thing. There are conditions where drops are not just in case, but the foundation of treatment, and skipping them is out of the question. But it isn't the pharmacy shelf or an ad that chooses them, it's a doctor, for a specific diagnosis that has to be made first, and that's the whole difference. One thing is to drop in something for redness for months and guess whether it's helping. Quite another is to find out once what exactly is happening with your eye and to use precisely what's needed for exactly as long as it's needed. And very often there's a third, most pleasant option, to hear that you don't need drops at all. That it's enough to change a habit, how you sit at the screen, how your eyes rest during the day, how you put in and take out your lenses. It's worth clearing up a couple of the most common misconceptions. First, if drops are sold without a prescription, then they're safe and I can use them as much as I like. But being sold freely is about availability, not about whether the thing suits you and suits you right now. And the second, probably the most common, red, tired eyes are a trifle. Drop something in and it's gone. Sometimes it really is a trifle, but sometimes that is the first and only early sign the eye is giving you. And muffling it with drops month after month means simply deciding not to hear it. So how do you understand it's time to go not to the pharmacy but to the doctor? The markers are simple. If the redness comes back again and again the moment you stop dropping, if the eyes get dry, tired or burn regularly, not just once after a sleepless night, / if you've been using the same drops for weeks and it isn't getting better, or it only gets better while you're using them, and especially if something has changed in the vision itself. If there's pain, sensitivity to light or discharge, this is not a reason to panic, not at all. It's simply a reason to stop guessing and calmly find out what's going on. So if a whole little collection of bottles has already gathered at home and the eyes still go red or tired or dry anyway, the most sensible step is not to buy one more set of drops, but simply to come in for an exam. So if a whole little collection of bottles has already gathered at home and the eyes still go red or tired or dry anyway, the most sensible step is not to buy one more set of drops, but simply to come in for an exam. At the Ko'z Nuri Clinic, a doctor will look at the eye, find the real cause and tell you straight, do you need drops at all? And if so, which ones exactly and for how long? Quite often a single visit like that saves a person both money and years of treating something they never had. Let a specialist choose the drops for your eyes, not a pharmacy shelf and not an ad. You can always come in for an exam at Ko'z Nuri, and honestly, that's far more useful for your eyes than one more bottle bought on a guess.